Hello, do you live in the US? Are you a nurse or a patient who has had to seek medical treatment here? First of all, I'm sorry. Second, I need your help. I am seeking some changes that can only happen with a bit of legislative support, and I want to tell you about it. A bit about me before we get into it. I've been an LVN for 13 years. I got a Bachelor of Science in Public Health, and I have a Master's in Health Law and Policy. So I have, a little experience in this space, but not much, hence why I'm asking for some help. So to finish up that graduate program, you have to do a thesis, right? So my thesis, I chose to focus on a body of research that would help me eventually draft this policy proposal. It took me 3 years, but I finally finished it, and I'm proud of myself. Good for me. So a super duper quick rundown of this. Basically, it would help LVNs that have practiced in the state of Texas as an LVN for the past 5 years to sit for the NCLEX RN, which is the national board exam for RNs. And that would grant us conditional licensure to practice RNs only within the state of Texas while we pursued our BSN for 5 to 7 years. After that, if you have finished your Bachelor of Science in Nursing, you get to continue being a Bachelor of Science in Nursing. Congratulations. All those things open up for you. The sky's the limit. Love that for you. Now, if you don't finish your Bachelor of Science in Nursing within those 5 to 7 years, well, you retain your LVN licensure and you can continue practicing as a nurse. And it actually still benefits you because those credits don't just not count after that. Okay, so adopting something like this, what are the benefits? So not only are we going to start alleviating the RN shortage, which is critical within the state of Texas, it's actually one of the worst in the nation. We're going to be promoting workforce retention because nurses are just leaving the bedside at a rapid clip, especially after COVID. Things got really messy, y'all, and so many of us are sick of it. So, and then, it promotes professional advancement. And where does the benefit really come in for our patients? Well, there are studies that have shown, and I don't know how to do the green screen thing. I'll probably put it in the comments or something. But there are studies that have shown that having more RNs at the bedside promotes better patient outcomes. So I know patients, you guys really want high quality care. We're not able to give it to you if we are continually burnt out, disrespected, not heard by our management. Help us help you. And in that, I really need your help. So this call to action is, I really need you guys to reach out to your legislators if you are in the state of Texas, or even if you're from out of state. Call some of these people here in Texas and be like, hey, this girl has young-ish person has a policy proposal that she's drafted that can really benefit patients and nurses alike, and really everybody. I'm going to get into it in future videos, so please stick around. Like this video, repost it for some visibility, and hit that plus button because I'm going to be talking about this more in finer detail, and I really want your questions. Please talk to me. I'm so glad that you're here. Glad to meet you. See you soon.